Hey, I'm Andrew with 10 Minute Therapy. In today's video, we're going to examine different forms of anxiety disorders. Now, in our past few weeks, we've been looking at what anxiety is, how it functions, and most recently, we've examined bottom up and top down anxiety, essentially two different origin points that anxiety enters into the brain. But today, we're going to look at different ways that anxiety then manifests from those things, what we might call anxiety disorders. So let's go ahead and get the clock started. We'll get into it. So when we examine anxiety disorders, something that we need to step back and start with is what we looked at in our last two videos, that anxiety has two different origin points in the brain. Essentially, we have top-down anxiety and bottom-up anxiety. We examined that in top-down anxiety, anxiety is originating in the front of my brain, the top of my brain, that frontal cortex. Essentially, anxiety is originating in my own thinking. And from that thinking, it is triggering anxious response in the back of the brain, known as the amygdala. In the bottom up anxiety, what we examined is that anxiety is not originating in my thinking in this case. Instead, it's originating from external factors, external stimuli. Something is triggering a part of my brain to respond anxiously, even though in the moment I may not have been thinking about anything that was particularly anxiety producing. And so from these two origin points, we then get a plethora of ways that anxiety manifests, and we refer to these as different anxiety disorders. And the goal of this video in examining these different anxiety disorders is not to just educate the general public on anxiety, but also to help people recognize that anxiety can look and feel a number of different ways. And the hope, as always, is that if you hear something in this video that sounds like what you've experienced, or maybe someone you know or love or care for has experienced, it may be a good thing to meet with a counselor and talk through some of these pieces. And so to start off, it makes sense that we would start with a disorder that we often just refer to as generalized anxiety disorder. Generalized anxiety disorder is pretty much exactly what it sounds like. It's generalized anxiety. It's an individual who's wrestling with anxiety with some regularity. In other words, it's happening in more than one area of my life. It's causing disruption. And I'm not exactly anxious about one particular thing. I might be anxious about many different situations and places and experiences. And typically, when we talk about generalized anxiety, we are talking about that top-down anxiety. It's originating in my thinking, and my thought processes are actually the main culprit here. Generalized anxiety might look like negative loops of thinking. It might be someone who engages in a lot of what-if thinking or catastrophizing or predictive thinking. We'll examine all of those in a later video. But in the meantime, generalized anxiety might just be someone who is wrestling through anxiety in more than one situation, more than one trigger, more than one thing. And often the root cause, though not always, is going to be one's own thinking. And so how do we treat generalized anxiety? Well, counseling is a great place to go for generalized anxiety because what we can do is utilize one of my favorite approaches, which is cognitive behavioral therapy. And in CBT, what are we doing? We're rewiring how we think. If the root is in my thinking, then it stands to reason we've got to change some of these thought processes in order to create change in the individual and how they feel and in how they respond. So generalized anxiety tends to be top down. Our approach then is going to be let's retrain how we think and change those patterns of thought in order to eliminate anxiety at its root. And this then leads us to a couple other forms of anxiety. The next one that kind of comes to my mind here in rightful order would be often what we refer to as phobias. You may not realize that phobias are a form of anxiety, but they are. A phobia is more specific than a generalized anxiety because rather than many different persons, places, or things causing an anxious response in me through my thinking. A phobia is a little more specific. A phobia is a particular fear, a particular worry. And as you can probably find through a Google search, there are many, many names for phobias around specific things. Some of the more known ones might be agoraphobia, fear of outside open spaces, arachnophobia, fear of spiders. There's many of these that we don't need to list out in this video. Suffice to say that phobias are a specific fear, a specific focus of my anxiety that becomes almost even obsessive at its worst case. And that I think, once again, top down, I think in a particular negative, fearful fashion about this thing that it creates anxious response within me. Unlike generalized anxiety, where we want to retrain our thinking, in phobias, we actually might be better off doing what we would call exposure. Exposure is exactly what it sounds like. It means that in order to help the individual no longer react fearfully to this particular thing, or even to think negatively about this thing, we actually have to expose ourselves to that source in order for my brain to learn I no longer need to fear this or live in fear thinking about this thing. Exposure is highly effective at treating phobias, and if you or someone you know lives with a particular fear like that, a counselor would be a great place to walk through some of those steps. And as we examine phobias, it leads us really into another form of anxiety that's very, very common in our society over the last 20 years that we often call social anxiety disorder. In fact, it's often now referred to as social phobia. Social anxiety disorder is, in fact, a type of anxiety disorder. It is, in fact, a type of phobia. It's just, once again, very specific to a phobia centered around social situations. And it tends to come in two different forms. It might be that my social anxiety is specific to speaking in front of a group of people or being the center of attention in a group of people. It might also be just a general social phobia where being in a large crowd of people is overwhelming. It might be that having to talk to a small group of people even is overwhelming. With social anxiety or social phobia, once again, our treatment method for addressing this is going to be directly attacking it at its source. And so while some CBT and retraining my thinking might be helpful, actually exposing myself to the very thing that makes me anxious, as unpleasant as that might be, is a highly effective way in which we can then help overcome this anxiety. And first, through these first three that I've mentioned, generalized anxiety, phobias, and social anxiety, I hope you hear me repetitively say these are very treatable conditions. These are not things that I need to live with for the rest of my life. In fact, through counseling and therapy, we can work through these with a high rate of efficacy in order to treat and overcome them. But this then leads me into a couple other anxiety disorders that are a little more tricky. That doesn't mean they're hopeless. It doesn't mean we can't treat them, but just tricky. They take some work and some time to really overcome. And the first one that comes to my mind is PTSD, or post-traumatic stress disorder. Now, most of the public is familiar with PTSD because it's been popularized through movies, films, TV shows, books. And so most people probably feel like they have a general idea of PTSD. We tend to think of the combat veteran who returns home and has a hard time adjusting. But PTSD, in my experience, has come through working with police officers, yes, and sometimes veterans, firefighters, everyday people who have experienced a traumatic event. It's not always the combat veteran. PTSD affects a lot of folks. When we look at PTSD, though, something that makes it different from these other types of anxiety we've looked at so far would be that PTSD is not a top-down anxiety, but actually a bottom-up anxiety. If you go back and watch our video on bottom-up, you'll recognize that PTSD comes from the very fact that someone has experienced a traumatic event and now sounds, sights, smells, tastes, any sensory information that reminds the individual of that event triggers an anxious response. And so in PTSD, retraining our thinking isn't going to be as helpful as actually talking through the event and then exposing someone to the stimuli that's triggering that reaction and allowing, again, through exposure to do its work on the brain until the individual's brain quits reacting in that manner. And then this leads me to the last one we'll cover today, which is OCD, or obsessive compulsive disorder. Now, many people, again, won't necessarily loop OCD into anxiety disorders, but when we look at what OCD really is, it's not a disorder about washing hands. It's not a disorder about fear of germs. Those are specific examples popularized in TV and movies. But really, OCD has to do with obsessive thinking, so top-down anxiety, where one's very thoughts are hyper fixated on something that's stirring up anxious response in the brain. What makes it unique amongst other anxiety disorders, however, is that obsessive thinking actually then is met with what we call compulsions. And so we have these two facets: obsessions, thought processes that are hyper fixated on something in particular. And then in the individual's attempt to alleviate the stress and anxiety associated with those thoughts, they develop a compulsion. So in the popular myth of washing hands being an OCD response, what's really happening is that there's actually a thought process that is hyper fixated on thinking about a fear of germs. And so the individual thinks, if I wash my hands enough, I don't have that fear of germs. What they inadvertently do is pair two things together. Now I have a hyper fixation of fear that I'm obsessed in my thinking about, that I've paired with this action, this compulsion where I wash. But hear me say, OCD can take many forms. The hand washing is just one way in which it manifests. Here again, we have an anxiety disorder that needs to be treated through retraining my thinking, top-down approach, but also stopping and removing, eliminating the compulsion, the action of washing my hands. In order for both of these things to take place effectively, I have to engage in both of those treatments. Well, as you can see, we went way over our time limit today. But I hope that what sticks with you is that you hear all these different ways that anxiety can manifest itself. And if anything that has been said in this video today hits home for you, or maybe describes someone that you know and love and care for, I want you to hear me say these are all very treatable forms of anxiety. They can all be overcome through counseling, through therapy, with someone who knows how to guide you through them. Time for us to wrap up, as I'm over time. We are going to begin to wrap up our whole series on anxiety and start to dive into a little bit of cognitive behavioral therapy in our future videos. So check it out. Share it with people that you think might benefit from it. In the meantime, I'm Andrew with 10 Minute Therapy. God bless.